As a child, I really had the privilege that the idea of being a physician was a real possibility for me. My father was a physician. He was the only one of 14 kids to leave Mexico and then come to the United States to do his residency in psychiatry and child psychiatry.
Like her father, Mark Amaya, a Duke Emeritus Professor of Psychiatry, Lisa Amaya-Jackson has dedicated her career to helping children. She is a national expert on diagnosing and treating children who have been exposed to trauma.
And I found myself really wanting to know how, what, where, when was trauma contributing to the psychiatric conditions and child developmental outcomes.
As a UNC Robert Wood Johnson Clinical Scholar in 1991, she joined UNC and Duke mental health professionals to address the needs of hundreds of children and families traumatized by the disastrous Imperial Foods fire plant in Hamlet, North Carolina.
And so here we were looking at this industrial man-made disaster and trying to figure out how to help this ravaged community or communities like it.
She and Duke's John March secured NIH funding and created a child and adolescent post-traumatic stress disorder measure and foundational evidence-based trauma treatments for children and adolescents with PTSD. At the time, this was pioneering work and
became the foundation for trauma-focused treatments and interventions across the country over the next decade.
This work earned her and March an American Academy of Child and Adolescent Psychiatry Excellence in Service Award in 1996. Amaya-Jackson joined the faculty at Duke in 1993. She is a founding member and co-director of the Center for Child and Family Health, a Durham-based trauma-focused treatment and research center. Launched in 1996, the center is a collaboration between Duke, North Carolina Central, and UNC that serves more than 2,000 North Carolina children and families each year.
Truly, my heart and soul was captured in this work to create the center.
In 2002, she was asked by Duke's John Fairbank, the founding co-director of the National Child Traumatic Stress Network, to become associate director. She became deputy director in 2018 and co-director in 2020.
And this was really the opportunity of a lifetime to help children get access and quality of care across our country, whose lives had been devastated by maltreatment, violence, and disasters.
Amaya-Jackson and her husband Scott have been married for 37 years and have 2 children. She says she is especially proud to receive the Humanitarian Award from Duke, a place that has been dear to her heart her entire life.
I really relished being part of Duke and the professional life I've had at Duke of interfacing with other faculty and other learners.